Hello everyone, it's Dr. Ryan coming to you from my office again with another video review of one of the Step 1 free 120 questions. Today we're going to take a look at Block 2, Question 39. As always, I'll put a link to the actual question below this video, but on this slide I've summarized the key points. So this question describes a 74-year-old man who had cardiac valve surgery 1 month ago. On physical exam, you can hear a click from a mechanical valve, and then they give you chest x-ray images of a PA and lateral where you can see a valve inside the heart. And they ask you, based on these findings, which of the following cardiac valves was most likely replaced in this patient? And we have 4 answer choices, all being the 4 cardiac valves. So I'm going to give you a trick that you can use whenever you're faced with a USMLE question that has media attached, some type of image, maybe a path image, an x-ray, a CT, an EKG, whatever. You should first try to answer it without using the media, because in many cases you can, and that includes this question. So you absolutely do not need the PA and lateral chest x-ray to answer this question. In a 74-year-old man who had recent cardiac valve surgery, I'm going to tell you that 99 times out of 100 in real life and definitely on board exams, that is going to be aortic valve replacement surgery for aortic stenosis. The primary valve condition that older patients like this man get in the United States is aortic stenosis. One of the most common cardiac surgery valve operations is aortic valve replacement for aortic stenosis. And that is really the only condition this man could have had that led to valve surgery a month ago. Can patients in this age group get other valve diseases? Of course, but those are very, very rare. And far and away, in a man in this age group who has valve surgery, it's going to be aortic valve surgery for aortic stenosis. As to the other answer choices, mitral valve surgery would be done either for mitral regurgitation or mitral stenosis. This man has no reason to have either of those conditions. Mitral stenosis usually occurs in patients in their 20s and 30s, younger patients who had rheumatic heart disease as a child. Mitral regurgitation occurs in patients who've had myocardial infarctions, who have heart failure and dilated ventricles, but this man doesn't have anything like that in his history, so it's extremely unlikely he had mitral valve surgery a month ago. Surgery on the pulmonic valve is almost unheard of, except for children who have rare congenital heart conditions. There's no reason to think this man would have had surgery on his pulmonic valve a month ago. And then finally, the main group of patients who needs tricuspid valve surgery are former drug users who've had endocarditis of the tricuspid valve, and now they have severe regurgitation. And they don't give you any history like that in this man. So once again, without using the images at all, you can quickly come up with the fact that this man must have had aortic valve surgery a month ago. Now, if you want to understand the chest x-ray, I'll show you this example right here. So these are where the 4 valves sit inside the heart. This is the tricuspid valve right here. This is the aortic valve here. This is the mitral valve here. And this is the pulmonic valve right here. I'm going to bet almost no medical students know this, and I don't think many medical students would have been able to use the x-ray images to identify which valve was operated on. And most medical students who get this question right are going to get it right simply because they recognize that the demographics of the patient really only fit with aortic valve disease and not disease of any of the other valves. And that concludes our video review of the Step 1 Free 120 Block 2 Question 39.